With the right home remedy, you may not need surgery to get rid of kidney stones. As an added bonus, some of what we'll discuss may even prevent stones from forming in the first place. Home remedies 3 and 6 are favorites of ours and have benefited many of our patients over the years, so pay close attention to those. Oh, and be sure to pay close attention to number 10 because even though it's effective and may seem simple and harmless, it can lead to some serious complications, including death if done wrong. Let's start our list with something easy and something you really should be doing, kidney stones or not. Number 1. Stay hydrated. Increase your fluid intake, especially water. Your goal would be to produce at least 2 liters of urine per day. Doing so can help prevent stone formation. By staying well hydrated, you flush out the urinary system and prevent minerals which can aggregate and form into stones from concentrating in your urine. Your goal would be to drink enough fluid to keep your urine light yellow or clear. If you have trouble drinking enough water throughout the day, try setting reminders on your phone, or you can also search the App Store for apps that can help you with this. Sliding into number 2, change your diet. I know where your mind is going right now, but don't worry. This tip won't involve you going on drastic fad diets. Instead, your focus would be on making healthier choices. If you do need guidance, you can start by following a balanced diet program like that of the DASH diet or the Dietary Approaches to Stop Hypertension diet. As its name suggests, this particular diet is recommended by doctors to people who have hypertension, but it has been found to also be beneficial in preventing and dissolving kidney stones. The DASH diet emphasizes the consumption of vegetables, fruits, whole grains, and low-fat dairy products while limiting salt, sugar, and red meat intake. If you don't want to follow a specific diet, just try to be healthier overall with what you eat. Add portions of fruit and veg to your daily meals and lower your intake of sugar and salt. Now let's talk a little about kidney stones. Did you know that there are primarily 4 different types of kidney stones? Stick with us and we'll discuss each one as we go along. For now, let's jump back into our list of home remedies that will help you dissolve kidney stones and discuss home remedy number 3, apple cider vinegar. If you don't have this in your pantry yet, make sure to add it to your next shopping list. Not only is this great for dissolving kidney stones, it also has a lot of proven health benefits. Many people swear by it, including famous celebrities. In fact, singer Katy Perry went as far as purchasing the Bragg company because she is a fan of their apple cider vinegar. So you may be asking, what can apple cider vinegar do for my kidney stones? There are a number of possible reasons why apple cider vinegar helps soften and prevent kidney stones, but the main reason looks to be its acetic acid content. A 2019 study published in eBiomedicine found that dietary vinegar intake was associated with a reduced risk of kidney stone recurrence. Also, the acidic nature of ACV, particularly the acetic acid, helps in reducing the size and breaking down of kidney stones over time. This makes it easier for the stones to pass through the urinary tract. If you have acid reflux or hyperacidity and are concerned that consuming apple cider vinegar may cause a flare-up, we suggest you talk to your doctor about it. You can also watch our video on the 6 vitamins and supplements to stop acid reflux linked above. Now, moving on to another fairly easy fix for kidney stones. And it's number 4. Eat fruits and vegetables high in citrate. If you are going to follow home remedy number 2, which is changing your diet for the better, then you might as well make sure that the fruits and vegetables you eat are high in citrate. These include fruits like oranges, limes, melons, or tomatoes. So why does this work? This works because citrate binds to calcium and can dissolve some crystals before they turn into stones. Incorporating a variety of citrus fruits into your diet can help increase your citrate levels naturally. For the best results, aim for at least 5 servings of fruits and vegetables high in citrate every day. Now, next on the list is number 5. Limit animal protein intake. Hold on, for the meat lovers of you who are watching this video, don't click off. We are not saying that you should eliminate all animal protein from your diet, it's just a matter of limiting it. This is important if you want to prevent the formation of kidney stones and if you want to make it easier for you to pass the stones that you already have. This is recommended because consuming too much animal protein may increase the risk of developing uric acid stones. A 2002 systematic review and meta-analysis published in Advances in Nutrition found that higher intake of red meat and meat products as well as processed meat was associated with an increased risk of kidney stones. It even goes so far as to indicate that each 100-gram increment of red meat intake was significantly associated with a 39% increased risk of kidney stones. If you are going to have meat, maybe try going for fish or chicken. Minimize your intake of red meat or maybe save that for a special occasion. We're halfway done. If you're finding this video helpful, please do us a favor, like it and subscribe to our channel for more content on health and wellness from a channel run by nurses. Let's take a short break from the list and talk about the different types of kidney stones. Let's get to know the 4 different types of kidney stones, starting with the most common, which is the calcium oxalate stone. This type of stone usually forms in men who are in their 20s and 30s. It is formed when there are high levels of calcium and oxalate in the urine, causing them to combine and crystallize into a solid mass. We'll talk about the 3 other stones in a bit, but for now, let's go back to the list with another easy to follow home remedy, and that's number 6, increase your calcium intake. While it may seem counterintuitive, especially given what we've just discussed about calcium oxalate stones, in actuality, getting enough calcium from food sources can actually help prevent their formation. This is because getting enough dietary calcium helps increase the calcium levels in your gut. That gut calcium will mop up oxalates so they won't get absorbed into your bloodstream and as such won't get excreted in the urine. Now, on to our next tip, which may sound simple but can be deceivingly difficult, especially if you are a fan of chips and other salty snacks. You may have guessed by now that number 7 is reduce your sodium intake. According to a study published in the Journal of Urology, a high sodium diet can trigger kidney stones by increasing urinary calcium excretion. Excess sodium can lead to increased calcium in the urine, which, as we've already discovered, can contribute to kidney stone formation. In addition, a diet high in salt can also result in an increased risk of dehydration. If you ingest a lot of sodium and fluid intake is not increased accordingly, dehydration can occur, leading to more concentrated urine and a higher risk of kidney stone formation. For the best results, limit high salt foods like processed snacks, canned soups, and fast foods. When you can, look for processed foods that are labeled low sodium. If you do your own cooking, you can reduce your sodium intake by seasoning your meals with herbs and spices instead of salt. Let's take another break from the list and talk about 2 more types of kidney stones, which are the struvite stones and the uric acid stones. Struvite stones form in response to a urinary tract infection. These stones can grow quickly and become quite large, sometimes with few symptoms or little warning. They are more common in women. Uric acid stones can form in people who don't drink enough water, have a diet high in animal protein, or have gout, diabetes, or metabolic syndrome. They are more common in men. Now, back to our list of nurse-approved kidney stone home remedies with number 8. Avoid oxalate-rich foods. I'm sure you've been paying attention, so you know exactly why it's recommended that you avoid foods high in oxalate. It's because oxalate is necessary in the formation of the most common kidney stone, the calcium oxalate stone. If you already have kidney stones, reducing your oxalate intake while inversely increasing your calcium intake, add to that a daily intake of apple cider vinegar, then you all but guarantee that your stones will not only soften but won't grow any bigger. The above recommendation is also really helpful for anyone who is prone to stones or if you have had them before and don't want them to recur. So what are oxalate-rich foods? There are a number of these: spinach, rhubarb, Tree nuts like almonds and cashews, potatoes, beets, cocoa powder and chocolate, soy products like tofu, soy sauce, soy milk. Also included are legumes and certain whole grains. Fruits like kiwi, figs, and purple grapes are also high in oxalates. Moderating intake of these foods may be beneficial for people who are prone to developing calcium oxalate kidney stones. However, as you may have already noticed, many of these foods also provide important nutrients, so it is best to consult with a doctor or a dietitian for individualized guidance on balancing oxalate intake as part of a healthy diet. If you do consume these, try to mitigate their effects by drinking enough water and upping your calcium intake. If you are interested in swaps for these, check out our shorts feed as we have added a short on oxalate-rich food alternatives. Did you know actor Liam Hemsworth suffered from kidney stones and had to undergo surgery in February 2019? He attributed his condition to his vegan diet. Although there is no clear correlation between veganism and the development of kidney stones, the most likely culprit for Miley Cyrus's ex-husband was probably a diet high in oxalates and low in dietary calcium. Okay, let's move on with number 9. Keeping a healthy weight. To keep kidney stones at bay, you have to maintain a healthy weight. Being overweight increases the risk of developing kidney stones, especially uric acid stones. In addition to being beneficial against kidney stones, keeping your weight at a healthy range does a lot of good things for you and your health in general. If you are struggling to lose weight, talk to your doctor about it. They should be able to give you recommendations and tips for healthy weight loss. If you want us to come up with a video on nurse-recommended weight loss tips, leave us a comment in the comment section below, and we may just do that for you. Before we go on to the last item on the list, let's talk about the fourth type of kidney stone, which are cystine stones. These are the least common. Cystine stones are caused by a hereditary condition called cystinuria. This leads to excessive amounts of the amino acid cysteine collecting in the urine. This can result in the formation of stones in the kidneys, bladder, and ureters. Our last home remedy is related to this one, and it's number 10. Drink enough water. For cystine stones, drinking enough fluid to produce at least 3 liters of urine daily is the most important preventative measure. Doing so helps prevent cysteine from concentrating in the urine and forming stones. In some cases, medication may also be necessary to manage cysteine levels. A word of caution here. Be sure that you do not drink too much water, as that can be a serious problem, leading to a condition called water toxicity. Water toxicity, also known as water intoxication leading to hyponatremia, is a potentially life-threatening condition that occurs when a person drinks an excessive amount of water in a short period, causing a disturbance in the body's electrolyte balance, particularly the sodium levels. This causes fluid to move from outside to inside the cells, making them swell. When this happens to brain cells, it can lead to cerebral edema, increased intracranial pressure, and various neurological symptoms. It can even lead to death. If you have cystine stones, work closely with your doctor to determine your ideal water intake. There you have it, our list of 10 nurse-recommended home remedies to get rid of kidney stones naturally. If you are interested in bettering your kidney health, check out the link to the kidney disease solution in the description box below. If you found this video helpful, please do us a huge favor, subscribe to our channel and click on the bell icon so you get notified whenever we post something new. We are your wellness journal. Have a healthy day.